You're watching the award-winning American Health Journal.
Cerritos College has one of the finest dental assisting programs in the state. It's designed to give the student a fundamental knowledge and basic skills needed to assist the dentist in chairside procedures, performance of the registered dental assisting duties, and laboratory techniques. We spoke with Donna Waddell, Department Chair of the Dental Assisting Program at Cerritos College, to find out about the clinical experience in patient care they receive.
It's a one-year program, so they kind of are in the classroom most of the time getting trained for it. And they stay here on campus, but in the spring they actually go to USC and work with dental students, which my students really like because they actually get some of this hands-on with a real-life patient, kind of working with some of their skills that they've learned in this fall and doing real procedures, all the procedures that they are going to do in the office. And my program goes to the summer, and they're 6 weeks into internship, where they're working 3 weeks in a general practice and 3 weeks in a specialty, doing all of the assisting that an RDA would do in the state of California.
Donna Waddell told us what role a dental assistant plays in assisting the dentist.
The doctor depends very highly on that dental assistant. Because the doctor is going to go from one operatory to the next operatory, and that is dependent on that dental assistant to have that operatory set, ready to go, so that when they come in, that patient is in the right place, ready to go. The doctor sits down, it functions, it flows, and then the doctor can move to the next room, and that patient is ready to go. And that's all very dependent on the assistant. And most of my graduates get jobs right from their internship. They can get what we call just a dental assistant, so they don't have their RDAs. They will be waiting to take their RDA exam that month. They can usually get jobs starting at about $13, $14, maybe $15 an hour. Then after they get their RDA exam and they become registered dental assistants, then they would get pay increases. So they can be getting $16, $17 an hour. And then from there, with experience, it would go up in the pay scale. There's so many other avenues, and I really try and stress that with my students, that you don't have to go to private practice. There's group practice, the military. Some students can go into sales. And we talk about lateral career ladders and the upper career ladders, so that you can move so much in dental assisting. So it doesn't have to be just a solo private practice. There's group practices. There's also, like I said, I had a student 2 years ago. He's now into dental sales. So with that knowledge, you can go in with other avenues. So I tell him not to lock it in. One of the nice things is we do see males in our profession. I have 5 male students this year. Last year I had 8 male students. In my internship offices that I visit, I have 3 of my males that are running the front offices, that are actually running the practices for the doctors. So it's really nice to see that it's not just a female practice, but it is becoming both avenues.
We also asked Dr. Max Martinez, who instructs in the dental assisting program, what's required of the students going through that program.
In a program like this, the students are exceptional. They're ready when they leave this program. They've not only done the lab work that they do in classes like this, but they go out, say for example, to USC schools. Not only that, for example, my office is used to bring in some interns before they graduate to actually treat real patients, per se, to know what's out there. They're taught here all the basics. You have to start with the basics. Obviously, you wouldn't want them working on a patient right from the start. So they have mannequins, they have typodonts. Typodonts are teeth that are arranged pretty naturally, like to a human oral cavity, and they work on these mannequins, they work on these oral cavities and they have to pass these certain criteria before they can actually do it on a live patient. These young men and these young women, we want to make sure that they're prepared for 2 main things. One, to pass their certification, state certification licensing board, which is being a registered dental assistant. But most importantly, we need to teach them, we need to make sure when they go out to the dental field that they are prepared to go into any office, and this program just prepares them just exceptionally, where they can go in any office and be an asset to the dental office.
I want something wherever I go, it's always in demand. So I've been reading, I went online, read about dental assistant, found out it's always in demand. Everywhere you go, there's a job for you. And I got fascinated by it, and I like to work with others. I'm a very social person, and I feel I can make them feel comfortable and relaxed, and that got my interest in getting to a dental assistant. The only prerequisite is high school graduate, and you have to have a typing class, and some like up to a level of English, which is reading and writing, and a math prerequisite class. That's it. It's nothing major. It's not complicated. So high schoolers can easily get in that program once they sign up for it. And if everything's clear, then they should be in the program with no problems at all.